The way the body is talking to you about what disturbs this body is by messages, just like a text message. And the message can be as clear as, my knee is swollen, painful, tender, I cannot walk, I cannot do anything with it. This means that this joint is really in need of your attention. I'm Dr. Sahar Lashin. I'm double board certified internal medicine, anti-aging and regenerative medicine, and I am a Swiss biological medicine doctor as well, helping you in so many ways. So thinking out of the box and taking care of you in the different modalities, let me tell you what you need to do. If your body is giving you messages, please respect it. Listen to what your body tells you. Try to understand that pain is there for a reason, not to disturb you, but for the body trying to help you to control the situation early. So, if your joint is that painful, we need to search for a reason. And it might be wear and tear, but it might be a tendon which is just inflamed. It might be a muscle which is sprained. It might be crystals which is inside and causing irritation in the lining and inside the cavity of the joint. Or it might be gout, which means your body reacts in a specific way to uric acid when you eat red meat specifically or drink beer. Anyways, forever there is reasons that we can control, but the idea is, what is the pathology behind what's going on? Do we know the reason? Always ask your doctor, what is my diagnosis? Why is this happening? Don't go around with NSAIDS or ibuprofen or trying to control the symptoms when you don't know why. Ask why. So, I had a patient yesterday and she came in with a very swollen knee. She is limping, she cannot walk, and she has another problem in the opposite ankle. Of course, this can happen if you're moving incorrectly and using your knee or your one side different from what you're usually doing. But the idea is hearing the patient, touching the knee, seeing how inflamed it is, swollen, red, hot, angry knee. We started to talk in details about her condition. And guess what? There was a surprise about her history, which she never thought is relevant and never mentioned to other doctors, or when she did, it was just taken lightly and not connected with what she has right now. So she, as a kid coming from South America, she had rheumatic fever and she had inflammation in the heart. She had to take antibiotics for bad tonsils that was repeatedly there. And then she told me, oh yeah, I forgot to tell you, doctor, that since then they said I'm stable, but I have a heart murmur. When you examine a patient and you hear a heart murmur, always ask about the details. And when I told her I hear something, she remembered the whole history, and now she connected things that we have been thinking about. She has been to more than 5 doctors. Everybody says we don't know what's going on and we don't know why you're having all these pains for 2-3 months now. But if you think rheumatic fever, murmur, problem in the joints, it might as well be rheumatic activity. It might as well be an autoimmune disease. It might be a lot of things that has to be connected together in the proper way so she can treat it correctly. Patient was given orders for an echo on the heart, a referral for the cardiologist, and a list of labs she needs to do, as well as some natural holistic painkillers, till we are able to see exactly what is the problem in her heart and what is the relation between this and the knees. To be continued.